Now I'll call on Dr. Sharif Sahadulla, who's the CEO of Kim's Health. Sharif is going to be talking about how to leverage technology and really, again, managing your greatest asset, which is your employees. Maybe a case study on how Kim's Health has done it. Sharif, do you want to go ahead?
Samir, thanks for having me on this platform. Samir and I have known each other probably since we were 10 years old, so it's a pleasure to be here with him 40 years later. I wanted to talk, or Samir asked me to talk a little bit about what we as a healthcare organization are doing on the ground in terms of using technology and really developing our people and our people skills and even our clinical skills. Just to give you a really brief overview, Kim's Health is a healthcare organization spread over 6 countries. We're located in India as well as 5 countries in the Middle East. We have about a 2,000 bed capacity. We're over 20 facilities, and we see about 6,000 patients a day. And I think, as Samir said, any organization's strength really comes from the skill and the work of its greatest assets, their employees. Therefore, it was important for us to invest in the learning and the development of our employees. And at the end of last year, even before COVID struck, I really told my HR teams to let's make this a year of learning and development. And a big piece of that was to see how we can use technology to improve our skills. But we wanted to approach learning and skill development a little differently. And I think, as most people with kids have experienced this year, learning has changed considerably. So really, gone are the days when we used to go to conferences that spanned for several days to get our CMEs, to maintain our licenses, our medical licenses. So the approach we took was one of micro learning, to do things in small pieces. And we wanted, everyone's busy with work, with home life, and we wanted to be able to give education to people quickly, anywhere, anytime, and through any device, and adaptive learning at one's own pace. I think the other challenge really for us, we have about 5,000 employees, as I said, spread across 6 countries, is how do we standardize the service and the care we deliver? How do we ensure that our patients are getting the same experience, whether it's a hospital facility in India or whether it's a hospital facility in the Middle East? Now, for me as a doctor, it was also important from a clinical perspective that that, for example, if a patient comes in with pneumonia, that they're treated very much the same way, regardless of which facility. And this is really where evidence-based practice, clinical protocols, pathways, and order sets come into play. And this is something we've really attempted to standardize over all of our experiences, over all of our facilities. But it was also important that patients have a very similar experience. And I think the way we approached this, that it's important to have effective onboarding when an employee joins the organization. And this is really the only way that someone will understand our culture, our mission, our vision, and really our values. And that's what should translate into how they engage with our patients. But the challenge, again, we faced was that there was a lot of variability across the countries in terms of, how this was being done. So, with all of these points in mind, we partnered with IPC Health, and we launched a learning and development platform It's called Euphius, which means the active seeking of knowledge. And really, this was to build expertise and a continuous learning culture. It's a comprehensive learning solution, and we've incorporated skills development into it. This is a learning platform that we've incorporated with, partnered with IPC Health to develop something that is integrated with our management system, HR management system, so we can really track what employees are doing. If you could go to the next slide. Sorry, go to the next slide. Yeah. So it can be, as I was saying, it can be used for employee onboarding, and this is what we're doing with all of our new employees in our new bed tower. And we're incorporating customer skills training, talent assessment for India. The NABH is a very important aspect of it. We have extensive academics at our facility with 24 D&B programs, the Royal College of Physicians of London, and their internal medicine residency program, which is being done here, College of Nursing, and the KIMS Skills Acquisition Institute. So there's a lot of opportunities for us to take some of the academic material, put it on this learning and development platform, and allow more engagement between all of our employees, all of our residents, our students, at all of our facilities. Sorry, go on to the next slide. So, sorry, this is not very clear, but basically this is the portal once I log in, and this is my portal, and I've completed the activity that was assigned to me. Next slide. And once that's done, I get a certificate of completion. It's always nice to get online certificates. Just go to the next slide. Just go ahead to the next slide. The clinical aspect, I wanted to touch on the clinical aspect of it. You know, when I was doing residency in University of Michigan, the motto was really see one, do one, teach one, and that's really how we learned. And but that really throws into concerns about patient safety. If you're not experienced at doing something, should you really be, you know, quote unquote, practicing on a patient? And it's not only a matter about patient safety, it's also about healthcare provider safety. I remember when I was an intern, I was putting a central line in to an end stage HIV patient. And I pricked my my finger with the open bore needle. And that was really one of the scariest days of my life. And for the month after that, when I needed to get repeated testing and go on antiretroviral therapy. But had I had the necessary practice or training, perhaps that would have been prevented to some degree. So go on to the next slide. So when you couple a learning and development platform with a simulation and clinical skills lab, I think that becomes a very powerful tool in terms of the education, training, hands-on type of things that we can do. And from the American Heart Association, we saw some of the mannequins that they have for practice. We have adult, pediatric, neonatology, neonate, and you know, these are very complex type of mannequins They can cry, blink, talk, have various heart sounds and lung sounds. And we're able to, with our learning and development platform, as well as our online simulation and clinical skills lab, we're able to give a comprehensive solution in terms of preparing the doctors for tomorrow. Go ahead, next slide. This is part of the skills lab and other mannequin types that we have on there. Now, what the next phase of what we're doing, and you can go to the next slide. The next phase of what we're doing, sorry, next slide. Yeah, oops. Oh, I think you had an old presentation, sorry. So let me just, the next phase of what we're doing is incorporating virtual reality and augmented reality into the simulation lab. And so when I'm putting in a central line through the use of augmented reality, I'll have a better sense of where exactly I'm going. So I have the actual feel of a mannequin there, but with the augmented reality, I can say, okay, I'm going into the vein where I'm supposed to be, as opposed to the artery. So we're also using virtual reality for some of the clinical scenarios. And we've even started looking at virtual reality to treat certain patient conditions, patients with phobias of heights and crowds, and how we can use virtual reality to treat them by giving them essentially small bits and pieces of that exposure. So that's, sorry, that's it for me.
Really learning and development to improve quality of care. And what Dr. Bilani talked about, the three things, continuing education for the employees, employee satisfaction, wellness of employees. I mean, when you invest that kind of investments into making sure your employees have the right skill sets to deliver care, it's fantastic. Congratulations on all the good work. Can 5G and virtual reality headsets can be the next platform for surgical learning, and
Yeah, absolutely. There's a lot of work being done with virtual reality and augmented reality and education. I did my my undergrad at Case Western, and the Case Western Med School about 4 years ago had incorporated augmented reality using the Microsoft HoloLens into teaching anatomy. And they would have a hologram of a body essentially. And so coupled with dissection of a real body as well as a hologram, students could get a better perspective of the true anatomy, which sometimes is limited by a cadaver. And institutions like Cleveland Clinic are using augmented reality to prepare for surgeries. So this is a technology, and in India, technology companies and AI and virtual reality, it's booming. So we should really look at how we can incorporate these things into the care that we provide. And it's not going to be as costly as perhaps in the US to implement these technologies. And in the end of the day, it really helps to provide better care for our patients and prepare our doctors and our nurses and other staff in order to be able to deliver this care.
You've been in the US practicing in healthcare systems there. It's quite surprising that we don't have that much technology involved in managing training and development. What would you recommend hospitals? I mean, the urgency to do this, right?
I think given given our present situation, it becomes even more pressing for us to see how we can incorporate technology, because it's not we're not able to be as hands-on in terms of the teaching, perhaps as we have, and so our kids are having to adapt to this, and now medical schools and other institutions will have to adapt to a new form of learning. So I think it's essential in some way that all hospitals be able to deliver training to their employees, and now it has to be done virtually.
Great, great. Thank you very much. I think I'm going to wrap this up. I mean, our whole point today was to really have different perspectives, from the college professor to a university to a journal, any journal publisher, to an education company, and finally for the hospital, to really leveraging technology that will actually push us forward in one thing for all of us, and that's to deliver better care to our patients and to our country in India, and especially around the world. So I want to thank everyone here who participated in this session. I hope all the audience got to hear these perspectives. And I think two things from a hospital perspective, innovation is going to be faster and faster, and we need to look at this as an opportunity and not a threat. So for the hospitals to really invest, like how Kim's has done, and for the individuals, to really upskill ourselves continuously. The graph that Vikas showed of 4 years where your skills deteriorate, to continuously use technology to upskill. Today you can do it because you've got your phone. So I hope this day has inspired everyone to learn and continue learning and deliver better care. So over to you, Vidya.
Thank you, sir. With that, we come to the end of day 2 of CAHOTECH 2020. We thank the session chair, Mr. Samir Sharif, for moderating such a wonderful session. Thank you, sir. Thank you.